All right, moving into the formed elements. Formed elements are the cellular component. We are obviously going to have erythrocytes, which are our red blood cells, platelets, and leukocytes, or white blood cells. Now, this RBC and WBC abbreviation, you really do need to make sure you know those because you will see them on lab work and in patient files left, right, and center. So let's start off with the leukocytes. So white blood cells, or leukocytes, are divided into 5 categories. Well, 5 types. They're divided into 2 categories, granulocytes and agranulocytes. But there are 5 different types of white blood cells, and we can actually count them by doing what's called a WBC diff, white blood cell differential. Basically, with a white blood cell differential, we're going to count the number of white blood cells, and then we're going to tally, as we're counting, how many of those are of each of the 5 types. And there are certain ranges that we're looking for that indicate normal averages. And it is a range, just like everything in the body. So if we have, let's say, a neutrophil or a monocyte that is outside of the normal range, either decreased or increased, that can be indicative of different types of diseases. So, of our typing here, the most common white blood cell that we're going to find in the blood is the neutrophil. About 40 to 70% are going to be neutrophils, and most textbooks actually stick it at closer to that 60 to 70. The neutrophil is in the category of granulocytes, as well as eosinophils, which make up 1 to 4%, and basophils, which are going to be between 0 and 1. Granulocytes are called that way because when you look at them under a microscope, they appear to have dots or grains. And then the other category is the agranulocytes. When you look at them under a microscope, they do not appear to have dots or grains, and those will be the lymphocytes, which will be about 20 to 45% of your white blood cell count, and then monocytes, which make up 4 to 8%. So, leukocytes, as a generic whole, are going to form in your bone marrow. Leukocytes are going to be protective pathogen-destroying cells in various formats, and they have the ability to move in and out of blood vessels to reach various sites of inflammation or destruction. So when you have a cut or a wound or any damage, these are going to leak out of the capillaries specifically into the surrounding tissues to help take care of that. So, we talked about the 2 types. We have our granulocytes and agranulocytes, and granulocytes, as we mentioned, appear to have granules. But how do I tell a neutrophil from the eosinophil from a basophil? Well, the other thing we look at is the shape of their nuclei. They all have very distinct shaping. So here's our neutrophil. The nucleus of a neutrophil is going to have 3 to 6 lobes, as you can see here. The granules are going to be fine and be caught up with both basic and acidic dyes. Basic and acidic dyes, if you have not taken microbiology yet, will be explained in microbiology. And neutrophils' role is to eat bacteria and some fungi, as we mentioned, produced in the bone marrow. Eosinophils are going to have a bilobed nucleus, as you can see here. Granules are going to be coarse and acidic, so it's going to take on a red-orange hue. And eosinophils are going to be present in whenever you have a parasitic worm infection, elevated specifically in those, and will be involved in various immune complexes. Basophils have a U or S-shaped nucleus, and truthfully, this is not a fantastic picture, but the granules are going to be large and basic, so they're going to have a bluish-black tinge. Basophils are going to cause vasodilation in the arterioles by releasing histamine. So these are going to be involved in an allergic response. For our agranulocytes, we have our lymphocytes. Lymphocytes have a nucleus that is spherical and fills half or more of the cell with no visible granules. Lymphocytes are further divided into two categories. We're going to have our B lymphocytes and our T lymphocytes. B and T cells are going to be produced in the lymphatic tissues. B lymphocytes are going to be involved in what we refer to as humoral immunity. They create antibodies, which will then attach to a specific foreign protein marker, stating that this thing does not belong and needs to be destroyed. T cells are involved in what we refer to as our cellular immunity, and are going to be things like killer cells. These guys actively attack. We also have our monocytes. Again, we're going to have a U or kidney-shaped nucleus that is very large and will fill half or more of the cell with no visible granules. These guys become macrophages when they go out into the tissues, and they're going to provide defense against viruses and intracellular bacteria, especially when we have chronic infections. And they're going to be responsible for activating lymphocytes. So these guys activate these guys.